In this video, Living Well with Parkinson's, I'm going to show you how to use acupressure points to reduce the tremors, muscle stiffness, depression, and anxiety associated with Parkinson's disease. These acupressure points have also been shown to improve balance and coordination. You may be wondering, how can acupressure help with Parkinson's disease? Well, Parkinson's disease is the second most common chronic and progressive neurodegenerative disease worldwide. Long-term use of medications to control symptoms can sometimes lead to diminishing results and complications. That's where complementary therapies step in, offering new avenues of hope and relief. One such therapy that has gained significant attention is acupuncture point stimulation. It's not just an age-old tradition. It's a powerful tool that many Parkinson's patients have turned to in their quest for symptomatic relief. In fact, I'm going to share with you some remarkable findings from a systematic review of the effectiveness of acupuncture point stimulation for the symptoms of Parkinson's disease. The results are nothing short of impressive. Picture this, a comprehensive analysis of 25 randomized controlled trials evaluating the impact of acupuncture point stimulation on Parkinson's symptoms, demonstrating substantial benefits when combined with conventional treatments. And here's the real beauty of it all. This approach is refreshingly simple. I'm talking about tangible, measurable improvements that can make a world of difference in your daily life. By the end of this video, you'll have a clear understanding of how to use 3 acupressure points to reduce the symptoms associated with Parkinson's. In summary, Living Well with Parkinson's is your gateway to exploring an exciting, evidence-backed approach to symptom relief. So whether you're living with Parkinson's, supporting a loved one, or simply curious about holistic approaches to health, you're in the right place. Let's embark on this journey together and discover the simplicity and promise of acupuncture point stimulation in Parkinson's care. My name is Dr. Barrett. I'm a chiropractor, nutritionist, herbalist, and I'm certified in acupoint physical medicine and pet acupressure therapy. I've helped thousands of people live better naturally, and I want to help you too. If you like this video, please give me a thumbs up, subscribe, and hit the bell icon to be notified when more videos like this come out. The first point recommended to reduce the symptoms of Parkinson's is located on the top of your foot. To locate this point, put your finger on the space between your great toe and the next toe, right here. You'll be between 2 bones. Now, move up towards your ankle till those bones seem to come together, right here. Push in to find a point that is sensitive, sore, tender, or painful. That is the point. Massage this point in a circular motion for 1 to 2 minutes like this. Or if you have an acupressure instrument called a Shin, you can treat it with 25 pulses like this. Now find and activate this point on your other foot. The next point is located near your ankle bone. To find this point, put your finger on the tip of your ankle bone, right here. Then move back till you come off the bone like this. You'll be in a soft or hollow area. Push in to find a point that is sensitive, sore, tender, or painful. That's the point. Massage this point in a circular motion for 1 to 2 minutes like this. If you have your Shin, you can pulse it 25 times like this. Now find and activate this point on your other leg. The next research-tested point is located on the top of your head. To find this point, put your fingers on the tips of your ears, here and here. Then move up till your fingers meet together in the center of your head, right over here. there might be a little divot or indentation there. Push in to find a point that is sensitive, sore, tender, or painful. That is the point. Massage this point in a circular motion for 1 to 2 minutes like this. And here's another view. And with your Tei Shin, you can pulse it 25 times like this. And here's another view. If you or a loved one is dealing with the tremors, muscle stiffness, depression, anxiety, or other symptoms of Parkinson's disease, I recommend that you find and activate these 3 points 3 times a day for 30 days and then use them as needed thereafter. Now let's take a look at how to improve another problem associated with Parkinson's disease: sleep. I've put my video here. Check it out.